Today we're going to talk about H. pylori and treatment updates for, right now it's 2022 and the updates should be good through 2023. Most people that work in healthcare understand the implications of H. pylori going untreated. Those of you that don't work in healthcare but are interested in this topic, we do know that most ulcers are caused by H. pylori. So let's begin to talk a little bit about H. pylori and the updates and what that is. So put on your headphones or turn up the volume and just sit back or lay back and relax, and let's talk about it. So H. pylori is a bacterium and it does reside in the stomach. It is actually a member of the Epsilon proteobacteria group. It is a gram-negative microaerophilic bacterium. So its main house is the gastric mucosa, so it lives in the stomach. It's been thought to populate about 50% of the world population. However, the latest statistics were about 70% of Americans have H. pylori, and up to 85 to 90% of residents in Mexico may have H. pylori. Symptoms of H. pylori could be stomach ache, abdominal pain, bloating, burping more often than usual, getting really full and bloated after a meal. Coincidentally, these same symptoms are what we see in SIBO, which is small intestinal bacterial overgrowth. But the difference is H. pylori kind of comes on a little bit more sudden. Sometimes someone can go on a trip and then they come back and all of a sudden their digestion is not the same. And again, that can occur in a lot of other illnesses. But untreated, H. pylori can go on to cause other problems like ulcers. So for example, peptic ulcers, duodenal ulcers, and even gastric cancer. It is so deleterious to the gut that H. pylori has been classified as a group 1 carcinogen. So infections vary worldwide, and most practitioners believe that the CLR therapy is still the gold standard. CLR triple therapy is also known as the clarithromycin-based therapy, which was using the antibiotic clarithromycin. And basically you're placing the patient on 2 to 3 different antibiotics. But there is a very high failure rate using that model because now we have the prevalence of antibiotic-resistant strains. So we're moving into the advances. So now we've talked about how CLR or clarithromycin resistance is a problem now. We've now moved to the update that the bismuth-based quadruple therapy is the recommended treatment now, and that does include bismuth, which of course is Pepto-Bismol, a PPI, which is a proton pump inhibitor. You've probably heard of Prilosec, and then metronidazole and tetracycline, and the patient is on this therapy for 14 days. We have found obviously that this is superior to the prior CLR therapy that we are no longer using as the gold standard. So and I'll just say an interesting personal side note about that. Back when being a naturopathic physician, I would always tell my patients to start with Pepto-Bismol first because of the bismuth, because the bismuth sequesters the iron and it depletes the bacteria of that, and so the bacteria die off. And even now, I sometimes tell my patients, every now and then you could take a tablespoon of Pepto-Bismol. I kind of think that among some other supplements we'll talk about may help keep the gut healthy and really decrease the chances of coming across H. pylori infection. How is H. pylori transmitted? Well, it can be transmitted from other friends and family members that already have H. pylori, but again, you would be having to share silverware that's been used by the other person with it or whatnot. And more on that in just a moment. So Pepto-Bismol is readily found in this country. I am not familiar what's available in other parts of the world. I'm sure, something similar. And we're going to check my notes on the update of that. So just to clarify how H. pylori is spread, like I said, family members sharing silverware. So you have to have the direct contact with that saliva, and also direct contact with family members or friends' vomit, stool, and of course, contaminated food or water. And that's why when people travel, that's sometimes what happens. So the exact mechanism behind how H. pylori does cause gastritis or peptic ulcer in some people is really still unknown. So let's go back to our notes here. And so it's important to ask your patient if they have ever been treated for on a macrolide antibiotic or a fluoroquinolone-based treatment, because it doesn't matter why they were on those prescriptions. Because if they had any prior exposure to these medications, there's a high likelihood that they'll harbor H. pylori resistant strains. So more notes. So just some other additional things. There has been some information about PCABs. So before we were talking about PPIs like Prilosec. Well, a PCAB is a potassium competitive acid blocker. And this provides superior control of the gastric pH acid, allowing for the antibiotic to work better. So that's new since the 2017 treatment guideline. So there is FDA approval of the triple combination that used omeprazole, rifabutin, and amoxicillin that was approved in 2019 to treat H. pylori infection in adults. And there was some good results with that. So how peacabs do work, they can rapidly and they help reverse the proton pump preventing acid production. And it's able to elevate gastric pH to a higher level than PPIs can. And what else? So talking about refractory H. pylori infection, you have to ask the questions about antibiotics they've been on before, and if they've been on the clarithromycin-based therapy before, was it successful or did it fail? Do they have a penicillin allergy? These are other questions you can ask. So and then another thing is repeat testing. So all your patients should have H. pylori testing to confirm the successful eradication after you've done treatment. So the initial testing could be the urea breath or fecal antigen test, and even an upper endoscopy. But you want to repeat the test after treatment is completed. And then to avoid inaccurate results, you can do the repeat testing at least 4 weeks following therapy once it's over. And to avoid any false negatives, wait until the patient is off proton pump inhibitor therapy or PPI therapy for at least 1 to 2 weeks. So again, to review, H. pylori is a bacteria, and we now know is the main cause of most ulcers. So symptoms or patients may complain of gastritis, abdominal pain, gastric and duodenal ulcer history, and then the concern is this progressing to gastric cancer and also gastric malt lymphoma. And that's why it's very important to treat these patients. So again, the bismuth quadruple therapy is now the recommended first-line treatment. So that includes the bismuth medication, a PPI, metronidazole, and tetracycline. Another first-line treatment option, of course, is the rifabutin, and that was FDA approved. And PPIs, just to note, is the most widely used medication for gastric acid inhibition. But I have another video where I talk about the concerns of PPIs. So if you're on a PPI for H. pylori infection, it's a very short duration treatment. I know some patients that are on PPIs in the long term, but the problem with that, it's very important to have the acid in your gut. It helps kill pathogens. Certain types of food you eat has to be broken down so you can absorb those nutrients. And so gastric acid is very important. And there's a book by Sherry Rogers called No More Heartburn, and she's a medical doctor, and she goes into detail of why PPIs are not recommended to be on long term. So as a naturopathic doctor, the herbal preparations that I like to use for people with GERD or gastroesophageal reflux disease, or are recovering from gastritis and ulcer, but I've already treated them with this gold standard for H. pylori, which is what we just reviewed. But a few herbs that are very helpful: slippery elm, marshmallow root, GGL, also known as deglycerized licorice, milk thistle, and I get them off the PPIs after they've been treated. Now, there's many other herbs that help with GERD or esophageal reflux disease, stomach upset, but really, in practice, I've been in practice over 10 years, I find the slippery elm, the marshmallow root, and the deglycerized licorice have been the most effective. You can find those in an all-in-one supplement. You can find them at Whole Foods, Sprouts, most health food stores. But I'm not saying that these herbal supplements will treat and kill H. pylori. I do recommend, if you test positive for H. pylori, to be treated with the recommended first-line treatment. So that's some update on how to treat H. pylori. Other family practice physicians, I hope that helps you. And as a naturopathic doctor, just know that we use that same first-line therapy as well. Thanks for watching.